here. I'm particularly excited. This is the Winback TECAR AMA Ask Me Anything season opener. And in the beginning of each new year, I literally do two important things in my practice. And one is I ask every patient, and I'm going to ask you, what intentional or inspirational word do you want to embody more of in the year ahead? And it must be one word. And what I do in my practice is I write it down in my electronic, medical records. And throughout the year, I ask my patient members, how's that word going? How's it working out? In 2023, most patients, they chose words related to wanting less stress. So go ahead and put in the chat what your intention word is for 2024. And number two, the second thing that I like to do is each year I create a patient challenge. So for example, in 2023, I challenged all my patients to gain 3 pounds of muscle. And in 2024, it's all about regaining and maintaining lost range of motion. And that's what guides my conversation with patients. So I invite you to come along with this year's challenge and be part of this community that we want you to be. And let's have that conversation together. What are we doing to really regain all the possible range of motion that we can from our patients and then keep it, not lose it for the rest of their lives? And my hopes really for this group and what we are, before I reveal my best tips, is that this community really gives us an opportunity to share what we're doing and help each other understand TECAR and to explore the factors that practitioners are using. We learn about parameters, the energy levels, the duration, the frequency, the target tissue, and individual patient characteristics. This is an ask of the professionals out there on this call to volunteer and contact me or contact Dr. Dana now or sooner than later to talk about topics like post-surgical approaches or cases that you're dealing with that we aren't really supposed to talk about, like maybe cancer, or be willing to share your best practice tips in your office or other intimate office tips. And I think it's going to be a very, very, very exciting year. And these are the things that we want ahead. I have been tackling heat shock proteins and other cellular processes. I already have over 150 slides that I've put together to wrap my head around the heat shock protein concept and TECAR. Are we really stimulating them or not? You're going to have to wait to get my thoughts on that. But for those of you that are first timers that are joining us tonight, welcome. And I just want to share, what is Winback? What is Winback? It is a radio frequency therapy. It's certainly non-invasive. We use high radio frequency energy to heat targeted tissues in the body. There are definite molecular effects that can vary, and it just depends on the specific treatment area and the desired therapeutic outcomes. Some of these things are tissue heating. We definitely generate heat within the targeted tissue, and that creates increased blood flow, enhanced metabolism. We're speeding up metabolism, and this discussion of the activation of heat shock proteins. I certainly think when you're going high heat very fast, you probably are. They are molecular chaperones that help cells manage stress and maintain protein synthesis. And then definitely collagen remodeling. We've seen this a lot for tissue repair and strains and sprains, all of the things that we treat, tendon issues and other injuries. And the collagen production can even help improve the aesthetics arena, like sagging skin or wrinkles. That's a popular area, a big arena these days. And as far as the cellular metabolism, the radio frequency, it increases the rate of biochemical reactions within that tissue that we're treating. So that can lead to improved oxygenation, more nutrient delivery. All of these things support tissue repair and regeneration. I think of it also for inflammation and immune response, that this heating produced by our therapy creates a localized inflammation response or inflammatory response that stimulates the natural immune responses, and it does promote tissue healing and repair. Like, think about that in regards to the immune system. You really are stimulating it to repair. I also think of it as the chronic pain side of it and the acute pain for sure. It's helpful for my arthritic patients, for nerve-related pain. I think that it certainly interrupts the pain signals. It reduces that inflammation. It's probably modulating neurotransmitters and nerve function. And other responses, like the cellular responses, I feel that Winback induces cellular stress responses. And that creates activation of the antioxidant defenses and other molecular pathways in cell survival and adaptation. So it's quite a bit. We'll talk about energy levels and duration of treatment and the frequency of treatment throughout this year. That's what this meeting is all about. Then I'm going to tell you what my tips are, because Winback is a method to me. It's really something I call the Winback method. And these are my tips that I recommend to all of my patients to support their overall cellular health and well-being. So using TECAR, I think we're tapping into all of these complex cellular processes and enzymes and pathways within the cell. But I recommend all of these to get the best outcome and to support the cellular function doing the TECAR method. So breath work, to me, when I'm with the patient, I say, hey, look, I want you nasal breathing all the time. Always choose nasal breathing. And if they're on the table, we might explore crocodile breathing, or it's an opportunity for you to talk about whatever it is you do, a 4, 7, 8, or box breathing. That's an opportunity. Hydration is incredibly important. When I put lotion on a patient and I see that their skin is just soaking it up, I know they're dehydrated. So what I've been doing and what I've been having patients do that seems to be a really good little hack is I'm having patients try to front load their hydration. So personally, I'm doing 90 ounces of water within the first 90 minutes of my morning. What I notice is my exercise routine is better. I still drink the same amount of water throughout the day, but that front loading is important. And because this is a heat therapy, it does dehydrate patients. The other thing is diet. I really personalize it, whether it's keto, Mediterranean, paleo, or vegetarian. It's, something usually low carb. Just show me that you're eating a diet that's in a variety of whole foods. I think that's important. If this patient requires weight management, because if you are even 5% over your body fat, you are creating an inflammatory cytokine scenario. So I am that doctor that says to that patient, look, for a better outcome, you're going to need to lose some weight. And, it may just mean limit processed foods, or let's start changing out some of, these sugars and avoid them. And I do recommend the omega-3s to every single patient, whether that's, fatty fish or the salmon or mackerel or flax seeds or chia seeds, whatever it is, walnuts is their snack. They have an anti-inflammatory property, and I think it supports overall cellular health. And as far as protein goes, I talk to every single patient about protein because I need to ensure that they're getting adequate intake of a high-quality protein source. So for me, I know what their lean muscle mass is. I've done a body composition analysis, and I want them to have 1 gram of protein for every pound of lean muscle mass that they have. And almost every single patient is under proteined. When we're trying to heal patients, they need more protein. I talked to them about alcohol, probably no alcohol for most patients, or really limited. We just know that excess alcohol consumption is going to negatively affect cellular health and function. Every patient, I let them know this conversation about sleep. I want them no eating 3 hours before bedtime and just start getting to bed earlier or sleep an hour later for restoration during these treatments. And exercise, we're all doing exercise. I'm still a big advocate for patients, that need walking if, they're not walking. This year, I'm having every patient jump up and down 20 times as a minimum, 20 times a day. That's part of my osteopenia, osteoporosis prevention. Simple ask. I used to have patients do squats, and push-ups. Not enough. I want them actually jumping up and down, I think is a better recommendation. And then, of course, there's fiber on my list. In my top 10, I want every patient increasing their fiber. Fiber will soak up the toxins that are in their body. These could be telling them more whole grains, legumes, more veggies, and it also supports their digestive health and the gut microbiota. So all of these things are my top 10 tips. And you're going, well, Jeff, what's the TECAR tip? This is part of that method that I want to share. And then the last one is having great consults, which you all have, I'm sure. I've cultivated very specific healthcare providers, and they are my referrals or products I've vetted. And the last one that I want to talk about throughout this, conversation and at a later date is, what is our record keeping? I want to know, what's your record keeping, and have a common abbreviation. I've already referred patients, to Grant or, to Dawn or to other practitioners around the country. And I want them to be able to see what my notes say. And I want to know what your notes say and be able to read them and how we're treating along. So I bet the PTs have better notes than the chiros. And I'd love to see what you put in your notes, how you do this. But having, I think, common abbreviations would be really helpful for us. So that is it.